Good morning. Since May is National Stroke Awareness Month, we've got Dr. Machen and Glenda Wheeler of the Bluestem Medical and Gove County Medical Center here. And we'd like to find out a little bit more about this topic because I think there's a lot of people that don't know much about strokes. For example, a lot of people may know somebody who's had a stroke, and we hear a lot about strokes, but what is a stroke exactly?
Stroke is interruption of blood flow and oxygen flow to brain tissue, and it generally occurs when a blood vessel becomes occluded, when a blood vessel gets clogged up or a blood vessel ruptures, and it interrupts the flow of blood and oxygen to brain tissue.
Okay. Is a stroke preventable? And if it is preventable, how can it be prevented?
There are several things that cause a stroke. Uncontrolled blood pressure, uncontrolled diabetes, high cholesterol, smoking, plaque formation. Those are all modifiable and preventable. The other things that can cause a stroke are non-modifiable. Those include your race, your age, atrial fibrillation, genetics like sickle cell disease.
And so if someone is having a stroke, how would a bystander or another person, how would you know that? How would you recognize it?
Stroke usually manifests itself in fairly obvious, although it can be subtle symptoms, weakness and discoordination or falling down, difficulty with speech, difficulty with gait, confusion, severe headache. Anything else?
Dizziness.
Dizziness. Oh yeah.
Inability to speak, inability to understand what is being spoken.
Yeah, you can have double vision. You can have vision that just abruptly goes out in one eye.
Numbness, feeling of the face or the arms, legs.
Drooping of the face. That's the high points.
And so if I suspect that someone's having a stroke, what can I do besides dial 911?
Dial 911. Get them into the system as fast as you can. There's really not a whole lot that a layperson can do abruptly for a stroke. If you contact EMS quickly and get them to the hospital quickly, then they can get the ball rolling as far as evaluation and treatment is concerned. You don't know whether or not the stroke is caused by a bleed or by an occlusion of the blood vessel. Therefore, you probably shouldn't give them an aspirin or do any kind of medical intervention.
Okay.
The one thing that I want to say is stroke diagnosis is a time-sensitive diagnosis, and every minute that there's not blood flow to those other parts of the brain, you're damaging and losing brain cells.
That's right.
So the quickest way that you can get them to the hospital, hopefully 911 in an ambulance. The other things that I would say you could do if they're unable to stand, by all means set them down. If they're unable to keep upright or keep their airway open, you can assist with that. But otherwise get them here because of the time-sensitive diagnosis.
Time is brain tissue, and when you call 911 and activate the system, the stroke alert goes out and the hospital can anticipate that they're coming to them, and will be able to get some things ready ahead of time rather than reacting after they get to the hospital.
We're back with Dr. Machen and Glenda Wheeler to learn some more about strokes. And one of the things that we've learned, some of the basics about strokes, and we've heard about the Kansas Heart and Stroke Collaborative. And could you tell us what that is and how you're a part of it?
Sure. The Kansas Heart and Stroke Collaborative started with KU, Hayes Medical Center, and 13 critical access hospitals came together to help improve patient outcomes for strokes. One of of the things that they did is educate. That was one of the largest things they did. We had collaboratives that would come together and meet about how to quickly diagnose the stroke, how to implement the orders, how to administer TPA, how to get in touch with KU neurologists. So all of those things over the last 3 years have improved the patient's outcomes for stroke intervention. The funding came from the Center for Medicaid and Medicare, along with some help from KU and Hayes Medical Center.
Yeah, it was about I think about a $12.5 million grant that started in 2014. I was fortunate enough to be the medical director for the collaborative, worked with some great people, and Glenda summed it up real nicely as far as our goals and education of the public, education of providers, education of hospitals, streamlining the order sets, and getting everyone to approach a stroke in the same manner and in a uniform manner. We worked real hard at trying to streamline the referral process to get people with strokes to the secondary and tertiary centers in a timely manner, and the numbers at the end of the study and at the end of the collaborative involvement were pretty amazing, and in fact when the collaborative first submitted the numbers to CMS to review, they looked at them and actually sent them back again to have us we redid them because they were so good, because the improvements were so amazing and so profound in certain areas of stroke prevention, and how the whole area improved on recognition and timely intervention.
We were graded to speak on how fast from the time the patient got to our ER and how fast we got the CT, how fast we got the NIH scale performed, how fast we assessed them, how fast we gave the TPA, and those are the interventions that he said had improved over the 3-year period while we were working with the collaborative.
Okay, to sum everything up, what do you believe is the most important thing you'd like to tell us about stroke?
I think the most important thing is to do everything you can to prevent it. To try the importance of treating stroke begins before you have the stroke. Minimize your risk factors. Get your blood pressure under control. Get your sugars under control. Do everything you can to maintain a healthy lifestyle and avoid a stroke if at all possible. Because once the damage is done, brain tissue is irreplaceable.
And many of my patients say, I don't want to come see my doctor, nothing's wrong with me. But this is how we're going to prevent the stroke, is that we see you when you don't think you're sick, and we can look at those preventive measures and those modifiable risk factors that we can help you with to prevent you from having a stroke.
We've heard of this FAST before. What is that exactly?
This is a mnemonic to help people identify if someone is having a stroke. The F is for facial droop. If you ask the person to smile, one side of the face could be drooped. A is for arm drift. You can have them put their arms out in front of you, and if one drifts down, that would show weakness. S is for speech difficulty. Either they can't talk or they can't understand what is being said. T is our most important thing, is time. Call 911, get them to the closest hospital as soon as possible.
Thank you very much.
Thank you.
You're welcome.